I'm Megan Bory. I'm going to be doing an nasogastric tube insertion today. And in order for me to do that, I need to check doctor's orders. The doctor has ordered a nasogastric tube for tube feeding. And then I'm going to gather my supplies and make sure I have the correct type of tube and type of length and the right patient as well. So I'm going to knock on the door. Hand sanitize my hands. Hello, how are you today?
Good.
All right, awesome. I'm Megan. I'm going to be your nurse today. I'm going to be inserting a nasogastric tube. Have you ever had one of those before?
No.
All right, real quick, can you tell me your name and date of birth?
My name is CJ Love, June 23rd, 1987.
All right, so it matches the wristband. So this is the right patient. So have you ever had a nasogastric tube again? I'm sorry.
No.
All right, basically it's just a flexible piece of plastic tube that's going to be inserted through your nose and down your esophagus and into your stomach. And it's going to be feeding you, okay?
Okay.
Okay, I'm going to be adjusting the bed to a working position. Put the patient in a high Fowler's position. All right, I'm going to move you up real quick, okay?
Okay.
All right. I'm going to assess the nares. CJ, have you ever had a broken nose or deviated septum, or do you have any bleeding or trouble breathing out of one side of the nose?
No, I'm good.
Okay. The nares look patent. Can you blow out for me real quick? All right, that's really strong. Okay. All right, so I'm going to choose the left-sided nostril because it's very convenient for me. Okay?
All right, that's cool.
And for my preference, I'm going to lay a towel down and an emesis bowl in case the patient does get sick.
Okay.
All right, I'm going to check the NG tube. This is the correct tube compared to the Mars, the correct tube and type of tube. All right, now I'm going to be measuring the tube from the tip of the nose to the ear. Do you mind if I pull your shirt down just a tad bit?
No, you're good.
Okay. Down to the xiphoid process, and I'm going to be taping it with 4 inches of each tape. All right, move this back up. Towel back here. And this side, I'm going to be washing my hands again. And apply clean gloves. Just because I like washing my hands. CJ, real quick, can you tell me if you have any allergies? I just feel like asking.
No.
Okay.
Okay.
I'm going to take the tip of the tube and then insert it into sterile lubricating jelly, about 4 inches. Loosen that up. Alright. This is for you. This is some water. And when I tell you to drink some water, will you drink some water?
Yes.
Okay. Hold that for me.
Okay. I got it right there. Okay. Yeah.
Okay. Alright. And now I'm going to begin. Are you ready?
Yep.
Okay. I'm going to be inserting it in slowly. And if the patient appears to be coughing or gagging or feels any discomfort, I shall take the tube out just a little bit and then reinsert it when the patient is ready.
Oh boy.
And when I get to the first tape, I'm going to take that off. Alright, chin to chest. Patient is going to be chin to chest and drinking water. Insert it all the way down until the very last piece of tape, but the tubing won't let me. Alright, thank you. That was awesome. Okay, alright, it's reached the end of the tape, and I'm going to tape the tube to the nose. Alright, that wasn't so bad, was it?
Yep.
Alright, awesome. Okay, so I'm going to be checking the placement of the tube. Patient appears to be speaking clearly. Can you say hello for me real quick?
Yeah, hello.
Okay. There's no coiling in the back of the throat. That's a good thing. Alright. And now I'm going to be aspirating. Mind if I pull your shirt down again?
No.
Okay.
Okay.
I'm going to be injecting an air bolus. There we go. You'll be hearing a swooshing sound. Swoosh. That's a good indicator, but it's not the best indicator, but it sounds like we're pretty well off. And then I'm going to aspirate for gastric contents. And if hospital policy requires me to, we shall test the pH of the acid. But I'm going to re-inject it. All right, and now I'm going to check the length. Okay. I'm going to check the length of the tube and compare it to the baseline. And I will send the patient down to X-ray to actually verify the lifespan of the tube. All right. Are you feeling any discomfort today?
No.
Okay. I'm going to be taking another piece of tape, the Y, and tape that back on there. Okay. And then I'm going to slip knot a rubber band.
I love that band.
Oh, you do?
Yeah.
It's a great band, isn't it?
Yeah, it is.
Slip knot it. And give the patient slack, because if he turns his head, he won't pull the tube out. And take a bobby pin, pin it. And then I will take the end of the tube and apply it to a suction source. Usually it's on a low intermittent section, unless the physician orders otherwise. So that's going to be hooked up to this. All right, CJ, do you need anything else?
No, I'm good, thank you.
All right, I'm going to be lowering the bed just a tad bit, but it can't go under 30 degrees. All right, CJ. Well, you were a great champ today. Do you need anything else?
No, I'm good.
All right. Well, you know where the call bell is. Just let me know if you need anything, okay?
Okie dokie.
Okay. I'm leaving the room. And on my lovely Mars station, I will be documenting the type of NG tube, the size of it, the length, the type of tube inserted, the color and consistency of the drainage, the pH, if it's tested, the intake and output, the patient's tolerance, and the instructions that I gave to the patients, the amount of drainage, and the pH if it's tested. And I'll document all of that according to hospital policy.